This will be my first lecture on optimal use of ultrasound. Transducers are the tools that convert a type of energy into another. In ultrasound, the transducer changes electrical energy into mechanical energy with piezoelectrical effect. Quartz is the prototype of these materials, and these are the commonly used ultrasound crystals in the transducers. And the new technology is micro-machined ultrasound transducers. Crystals in the transducer vibrate with very short pulses and produce sound. Multiple sound waves compose a sound waveform in front of the transducer. The waveform has a near field, a far field, a focus area, and side lobe waves. This is the focus of the transducer. The transducer and the focus area is called the near field, the Fresnel zone, and away is the far field or Fraunhofer zone. On either sides, there are side lobe waves. The near field is cylindrical in shape with well-collimated high-intensity sound waves inside, and the sound waves propagate linearly. The best resolution is in that area. The Fraunhofer zone includes non-parallel beams and divergent waves, so the resolution is low and peripheral distortion occurs. Ultrasound waves can be collimated and focused. Narrow pulses increase the resolution. Focusing is directly proportional to the frequency, the transducer diameter, and the transducer concavity. The sound waves propagate in the media with compression and decompression movement inside of the tissue. The interaction of sound waves with tissues include the reflection, diffraction, scattering, but mostly conversion into heat, absorption and attenuation and total loss. The term acoustic intensity defines the power of ultrasound pulse per unit area, and the unit is pulse per square centimeters. As the intensity increases, the molecular movement in the tissue increases, compression, decompression in the tissue increases, and the penetration increases. The relative acoustic intensity term describes the logarithmic intensity ratio of received and submitted sound waves. And it's defined as in decibels. The term acoustic impedance is the resistance of the medium to the propagation of sound wave. And it's defined by the density of the medium and velocity of the sound in that medium. And it's the major parameter that determines the interaction of sound with tissue. In constant acoustic impedance, sound propagates without changing direction till totally absorbed, and it's totally converted into heat energy. At interface with different acoustic impedances, reflection, transmission, and refraction or scattering occurs. Reflection produces echo. The intensity of echo is proportional to the impedance differences. If impedances are equal, no reflection, no echo. Reflection coefficient determines the basic reflection physical event. And it's defined as the square of the differences of the impedances and square of the sum of the impedances. What does that mean? Increase in differences of impedances cause increase in echo. If impedances are equal, this will be zero, so no echo will be produced. Here are the sound of speed in biological media and impedance values of the media. Air and bone have extreme values, you see. Most of the soft tissues have these narrow differences, but fat is important and fluid is important when compared to the soft tissues. When we put the values inside of the equation, these are the tiny differences. You see the liver and kidney, but soft tissue and fat is more than this one. And that's why all are reflected from air or bone interfaces. Snell's law holds true for ultrasound waves as well. If the incident angle is over the critical angle, it's totally reflected. If the incident angle is less than the critical angle, refraction and reflection occurs. Reflection at irregular interfaces occurs in multiple directions. Tissues are composed of many specular reflectors that cause scatter. These tiny reflectors are called specular reflectors, and ultrasound images are based on these scattered echoes. Here are some examples what makes us to perceive the tissues, the difference between the tissues, the bright echoes, the lesions. This is the cumulative effect of tiny, innumerate specular reflectors. The other term is the attenuation, the loss of sound intensity during propagation inside of the tissue, occurring from reflection and scatter, divergence of sound, and mostly frictional loss. This is the formula of attenuation. Attenuation is inversely proportional to the attenuation coefficient and the distance traveled. Interaction with the tissue is a function of wavelength. Attenuation coefficient is related to the velocity and frequency. Intensity is related to amplitude and frequency. As the frequency increases, attenuation increases and penetration decreases. Let's talk about the image formation. There are two parameters for the device to make the image for us, the time and echo intensity. The distance is a function of velocity and time. For sound waves, it means 2 times of the distance. If we consider the velocity as constant, then the distance is a function of time. And the ultrasound device can determine the distance by only calculating the submitted and received sound wave time. The other parameter is the echo intensity, which is determined by the reflection coefficient, and then the echo is received, converted to electrical signal, and electronically processed and digitalized, and displayed in A, B, or M mode. A mode is the first one. It's not in practical use now. We use mostly the B mode or the M mode. This is the example of digitalization and image formation. In 1 bit, either black or white tones exist. In 2 bits, there are 4 shades. In 3 bits, 8 gray shades, and in 8 bits, 256 gray tones. The pixel values of a matrix is encoded with different gray tones, and the final image will be in the shades of gray. And this is how it appears, of course, in real time, in brightness mode. You see the liver echogenicity in that gray tone, the kidney medullary pylorus in another gray tone, and the sinus fat in another brightness. This is the other mode, the motion mode, mostly using echo in the imaging of cardiac or fetal cardiac imaging. In conclusion, ultrasound physics is necessary for a good practice. The next lecture will be about quality of parameters. Thank you for your attention.